I want you to imagine, just for a second, making a choice today to alter your body. Like maybe it's a procedure to feel a bit more comfortable.
Right, or maybe just to regain some confidence you feel like you've lost.
Exactly. And in the moment, it feels like an entirely isolated decision, right?
Yeah.
Something that belongs strictly to your present self.
hmm
But what happens if that exact choice unexpectedly builds a literal physical roadblock for your healthcare needs, like 20 or even 30 years from now?
It is such a fascinating dynamic to consider, mostly because, we are culturally conditioned to view our bodies in the short term.
Yeah, we want immediate results.
Right. We rarely think of our anatomy as this long-term living record.
Yeah.
So the idea that an elective decision made at age 40 could completely reroute a life-saving medical screening at age 65 is, well, it's jarring.
And that long-term consequence is exactly the mission of our deep dive today. We are investigating a highly specific but honestly critical question for you to understand.
Which is, can vaginal tightening procedures actually affect future pelvic exams after someone has had hysterectomy?
Yeah, it really is a collision of two completely different medical universes.
Oh, absolutely. On one side, you have the rigid, highly regulated world of routine cancer screening. And on the other, you have this booming, fast-moving industry of elective cosmetic procedures.
So to figure out exactly how these worlds are colliding for patients, we are going through a pretty massive stack of sources today.
We really are. We've got clinical guidelines from the American College of Obstetricians and Gynecologists,
We've got safety communications straight from the FDA.
plus detailed surgical overviews and peer-reviewed studies that look really deeply into how energy-based laser therapies actually change human tissue.
Right. And the goal here is clarity. There's so much noise online right now, so we really need to separate the marketing hype of the so-called rejuvenation industry from the undeniable anatomical reality.
Exactly. What are these procedures actually doing at a cellular level?
So to understand how tightening your tissue could possibly affect a future exam, we have to start with the baseline. Like, why does a patient who has undergone a total hysterectomy still need a pelvic exam in the first place?
That is such a good question.
Right, because you'd think that once the uterus and the cervix are removed, the need for those incredibly uncomfortable speculum exams would just, disappear entirely.
I mean, that is easily one of the most common misconceptions in women's health. For a lot of patients, waking up from a total hysterectomy feels like the ultimate finish line.
Sure, they're like, I'm done.
Exactly.
Oh.
Because a total hysterectomy involves the removal of both the uterus and the cervix, patients assume, quite logically, that the days of pap smears and invasive pelvic screenings are finally behind them.
And honestly, if the organ that typically gets the cancer is gone, the screening for it should be gone too. But the sources we have, specifically the clinical guidelines citing Dr. McLean and the American College of Obstetricians and Gynecologists, point out a massive caveat.
Right, a huge one.
If you have a history of abnormal pap tests or a history of human papillomavirus,
Yeah.
so HPV prior to your hysterectomy, you are actually still at risk.
Precisely. The target of the exam simply shifts. The clinician is no longer looking at the cervix, obviously.
Because it's not there.
Right. They are now required to perform what is called a vaginal smear. They are checking the vaginal vault, which is the very top, closed end of the vaginal canal, for vaginal dysplasia.
Now, wait, let me challenge that for a second, because I'm trying to wrap my head around this.
Go for it.
If the cervix is the primary environment where HPV thrives and causes those abnormal cells, how is the virus surviving and mutating in the vaginal vault decades after the cervix is physically thrown in a medical waste bin?
Yeah, that is the exact mechanism patients often misunderstand. HPV does not just vanish because its favorite host tissue was removed.
Wait, really?
Unfortunately, no.
Right.
The virus can actually live in the basal layer of the mucosal lining of the vagina itself.
Oh.
Yeah, it can lie dormant for years. And then it can begin altering the squamous cells of the vaginal wall, causing that dysplasia.
And dysplasia, just to clarify, those are the abnormal skin cells that can slowly develop into vaginal cancer, right?
Exactly.
And here is the detail from the ACOG guidelines that really caught my eye. This specific screening must continue for 20 to 25 years post-surgery.
It's a huge commitment.
It's like selling your car but realizing you still signed a 20-year lease on the parking spot, like you still have to maintain the space.
That is a brilliant way to put it.
But what does the doctor actually need from that parking spot to do their job? If the cervix is gone, the top of the canal is just sewn shut, right, into what you call the vaginal cuff.
Right, it is a closed canal. But to properly visualize that cuff and to ensure there are no microscopic abnormal lesions or, precancerous cells hiding in the folds of the tissue,
They need to get in there.
they absolutely have to use a speculum. They must open the vaginal canal completely to illuminate and physically access the very top.
Meaning the tissue of the vaginal canal has to be completely cooperative.
It does. The mechanical requirement of the exam itself is non-negotiable. It requires the vaginal tissue to be flexible, pliable, and painless.
It has to actually stretch to accommodate the instrument.
Exactly. And that specific mechanical requirement sets the stage for why intentionally altering that tissue for cosmetic reasons can become a complete disaster down the line.
So, if the tissue's primary medical job for the rest of your life is to remain accessible and flexible, why is there a booming industry dedicated to doing the exact opposite?
It's a wild contradiction, isn't it?
It really is. So let's look at what happens when patients intentionally try to shrink or tighten this area.
Well, to understand the industry, we have to clarify the terminology first. You will see the phrase vaginal rejuvenation plastered everywhere.
Oh yeah, on billboards and med spas, all over social media.
Right. But it is crucial to understand that this is a broad marketing umbrella term. It is not a precise medical diagnosis or a standardized procedure.
Our sources show people seek it out for a wide variety of reasons. It might be a feeling of laxity after childbirth or natural changes that come with aging.
Or the massive hormonal shifts you experience during menopause, yeah.
And the industry essentially offers two main approaches to achieve this tightening. There's the traditional surgical route, and then there's the non-surgical energy-based route.
So the surgical options have obviously been around longer. They primarily consist of vaginoplasty, or a procedure called a posterior colporrhaphy.
And that's actual surgery.
Oh, yes. In these operations, a surgeon physically uses a scalpel to cut away excess mucosal skin from the vaginal wall, and then they use sutures to pull the underlying levator ani muscles closer together.
So they are essentially tailoring the tissue, like they are taking in the seams to physically narrow the diameter of the canal.
That's a good analogy, yes.
But the approach that seems to be exploding in popularity and causing a lot of the controversy in our sources is the non-surgical side.
Right, the energy-based devices.
Yeah, we are talking about fractional CO2 lasers, erbium-YG lasers, and radiofrequency wands.
Those are incredibly common right now, mostly because they are marketed as lunchtime procedures. No scalpels, no general anesthesia.
I was reading through the peer-reviewed studies on these energy-based therapies, trying to figure out how shining a laser into the body actually tightens anything.
Sounds like sci-fi, right?
Totally. But the literature explains that these specific lasers have a high affinity for water. So when the laser energy hits the vaginal wall, it aggressively heats the water inside your tissue cells to a highly specific temperature.
Usually between 45 and 60 degrees Celsius.
Which is roughly 113 to 140 degrees Fahrenheit.
Right, it's hot.
Very hot. And the studies literally refer to this process as controlled thermal injury. They are vaporizing the top layer of cells through surface ablation.
Yes, and the body detects this sudden, massive heat injury and immediately triggers an emergency wound healing response.
It's trying to fix the burn.
Exactly. Fibroblast cells rush to the burn site to produce brand new collagen in a process called neocollagenesis.
So that is the exact physiological mechanism. The theory is that the new collagen will make the tissue thicker and firmer than it was before the injury.
That's the goal, yes.
I have to pause on that, though, because the reality of what we are talking about is intense. The medical strategy here is to intentionally burn the inside of your body so that it shrinks as it heals.
It is an aggressive intervention.
Isn't that basically playing with fire? It's like taking an accordion and shrink wrapping it. You might end up with a tighter, more compact package, but it can't play music anymore because the folds are glued shut.
The shrink wrapping metaphor is highly accurate here, actually. Healthy vaginal mucosa is naturally designed to be like that accordion.
Right.
It is highly elastic and features natural folds called rugae. Those folds allow the canal to expand and contract painlessly during intercourse or, a medical exam.
But the ablative lasers are actively destroying that surface to force a tightening response.
And that highlights the massive underlying risk. While the heat is supposed to be meticulously controlled by the practitioner, the biological line between healthy elastic collagen remodeling and rigid fibrotic scar tissue is incredibly thin.
Because everyone heals differently.
Exactly. Every single patient's wound healing response is entirely unique. You cannot predict with absolute certainty how aggressively a person's body will react to thermal trauma.
So what happens when the shrink wrapping goes wrong? Let's dive into the medical literature from our stack here, because when this healing response crosses the line into permanent scarring, it is diagnosed as vaginal stenosis.
Right. And vaginal stenosis is formally defined as the abnormal narrowing, shortening, and complete loss of flexibility of the vaginal vault.
Wow.
And it is driven entirely by the formation of scar tissue.
And scar tissue, by its very nature, is rigid. It does not stretch.
No, it is fibrotic. Once that dense collagen matrix forms to heal a severe burn, that natural accordion elasticity you mentioned is permanently gone.
To give you an idea of how seriously the broader medical community tracks this kind of structural damage, they use something called the CTCAE grading scale for vaginal stricture.
Yes.
So grade 1 means you have mild narrowing, but you aren't really noticing any symptoms. Grade 2 means the canal is noticeably narrowing, but a doctor can still, with some effort, manage to do a physical exam.
Right.
But grade 3 is where the nightmare scenario begins. A grade 3 stenosis actively interferes with the use of tampons, makes sexual activity excruciating or impossible, and completely blocks physical examinations.
The clinical case studies we reviewed from the NICE guidelines, that's the National Institute for Health and Care Excellence in the UK, they illustrate just how devastating a grade 3 stenosis is for the patient's quality of life.
I actually pulled the exact cases from those guidelines, and they are genuinely tough to read.
They are.
There was a 65-year-old woman who underwent 3 laser treatments at a private clinic. She ended up with a severely foreshortened vaginal canal that was only 2.5 centimeters deep.
Which is about 1 inch.
1 inch. The entire apex of her canal was filled with dense fibrotic tissue, making any sort of penetration, medical or otherwise, completely impossible.
And there was the case of a 68-year-old woman who also, after 3 courses of laser therapy, developed what the examining doctors described as a crescent-shaped fibrous band right in the middle of her vagina.
Oh my gosh.
Yeah, it created a severe partial obstruction. Her remaining tissue was described as pale, frail, and completely inelastic.
Let's bring all of these pieces together for you, the listener. Let's say you had a hysterectomy. Maybe years later you felt some laxity or discomfort, so you went to a clinic and paid for a laser tightening procedure.
Okay.
But your body's healing response went into overdrive, and you fell on the wrong side of that biological line, developing grade 3 stenosis. What happens when your oncologist or gynecologist tries to perform that mandatory 25-year vaginal smear we discussed earlier?
The reality of that scenario is incredibly stark. Because the scar tissue is completely rigid, inserting a standard speculum to visualize the vaginal cuff becomes excruciatingly painful.
And sometimes physically impossible, right?
Often impossible. The fibrotic stricture literally acts as a barricade. A procedure undertaken to feel rejuvenated in the short term has effectively blocked your doctor from performing a life-saving cancer screening in the long term.
But wait, if this damage is so severe that it's physically blocking cancer screenings, how is this industry still operating completely unchecked?
That is the million-dollar question.
Like, why are these laser procedures so aggressively marketed if they carried this kind of structural risk?
Well, it is currently a highly contested and controversial space in medicine. In 2018, the FDA, under Commissioner Scott Gottlieb, took a very rare public stance.
They issued a warning, right?
They issued a strong, explicit safety communication warning women against using energy-based devices for vaginal rejuvenation.
And they cited actual cases.
They cited a surge in severe adverse events reported directly by patients.
Yeah.
And that included the exact complications we were discussing: internal burns, massive scarring, and chronic unrelenting pain.
But I noticed in the sources that the industry didn't just back down after the FDA stepped in.
Yeah, no, they did.
A lot of medical societies actually pushed back, arguing the FDA warning was way too broad and risked scaring patients away from a tool that actually works. Because ablative lasers do have a legitimate evidence-based medical use, right?
Yes, and that tension is the core of the current medical debate. Ablative lasers have demonstrated efficacy for a formally diagnosed medical condition called genitourinary syndrome of menopause, or GSM.
Right. GSM causes severe vaginal dryness, advanced tissue atrophy, and significant pain because the estrogen levels have dropped so low.
Exactly.
So for those specific patients, intentionally causing microscopic damage to the thin, dying tissue to force the body to build a thicker, more resilient layer of cells can be a massive relief.
Yes. But that is a profound medical intervention for diseased or highly atrophic tissue.
Right.
The problem arises when that same high-powered medical intervention is marketed to healthy tissue as a quick cosmetic fix for someone just wanting to feel a bit tighter.
It's a classic case of a powerful tool being used for the completely wrong job.
The British Menopause Society actually released a fascinating consensus statement on this exact dynamic.
Oh, what did they say?
They argued that the possibility of thermal damage from the laser itself is minimal if used correctly because of how precisely it targets moisture. In their view, the paramount risk often isn't the laser device sitting in the room, it is the practitioner holding the wand.
Ah, meaning someone using this device in a strip mall med spa after a weekend training course, rather than a board-certified gynecologist who actually understands the complex microanatomy.
Precisely.
Yeah,
Using the device without performing a proper diagnostic screening first is where the danger lies.
that makes total sense.
Yeah, but the medical community remains deeply divided. I mean, on one hand, our sources include clinics reporting over 2,000 successful laser treatments without a single documented case of scarring.
Wow, okay.
But on the other hand, the overarching consensus from major medical regulatory bodies is that vaginal rejuvenation as a purely cosmetic procedure severely lacks long-term safety data.
So what's the takeaway there?
The absolute safest starting point is a comprehensive medical diagnosis, not just walking into a clinic and buying a laser package off a menu.
Because if that unregulated treatment goes wrong, the structural consequences are devastating. Which actually brings us to the most difficult part of our deep dive today.
Yeah.
What happens if the damage is already done? Like if you are listening to this right now, or you have a loved one who may already be facing stenosis, whether it's from a cosmetic tightening procedure, a previous surgery, or even pelvic radiation, what can actually be done to reopen that canal for those vital medical exams?
The most critical reality to accept is that severe scar tissue does not just fade away on its own.
It doesn't just relax over time.
No, you cannot simply wait for the tissue to relax. It requires active, dedicated, and often uncomfortable medical intervention to reverse.
The primary treatment outlined in all the clinical guidelines we reviewed is the use of vaginal dilators.
Yes, vaginal dilators are smooth, cylinder-shaped medical devices that come in graduated sizes. Patients must start with the smallest size their tissue can tolerate without severe pain. And gradually, over a period of many months, they work their way up to larger sizes.
So the objective is to mechanically stretch the tissue.
Exactly, applying consistent pressure to slowly break down the rigid collagen matrix of the scar tissue.
And reading through the physical therapy protocols, there are incredibly strict rules for this.
Very strict.
You have to use water-based lubricants because oil-based lubricants can actually degrade the silicone of the dilators and throw off the vaginal pH.
Right.
You have to actively learn to relax your pelvic floor muscles while doing it. And you can only start this dilation therapy after any acute inflammation or burning from the initial procedure has totally healed.
Yeah, it isn't just a quick fix. It is an intense daily physical therapy regimen.
It sounds exhausting.
It is essentially rigorous pelvic floor rehabilitation. And frequently, these patients also require localized hormone replacement therapy.
Like estrogen creams.
Yes. Doctors will prescribe topical estrogen creams to be used in conjunction with the dilators. The goal is to try and improve the baseline thickness and blood flow of the remaining healthy tissue while the patient works to stretch the scar.
The irony here is just glaring. I mean, let's look at the timeline.
Okay.
You pay thousands of dollars out of pocket to undergo an elective, unregulated procedure to intentionally shrink and tighten the tissue,
Right.
only to suffer a completely predictable complication that forces you to undergo months of agonizing physical therapy and daily dilator use just to stretch that exact same tissue back out.
It is a profound clinical paradox.
It really is.
And if we look deeper at the initial motivation, many expert gynecologists point out that the primary symptom, that feeling of looseness that drives patients to seek out these rejuvenation packages in the first place, is very often caused by underlying pelvic floor muscle weakness or a minor organ prolapse.
Which cutting away surface skin or burning tissue with a laser cannot possibly fix.
It cannot.
Yeah.
You are aggressively treating the surface mucosa when the actual structural failure is in the deep muscle layer.
That is so frustrating.
It highlights exactly why chasing an aesthetic or sensory goal without first getting a comprehensive anatomical diagnosis can lead to such profound functional loss. You risk permanently destroying the elasticity you actually need to receive basic, life-saving medical care.
We have covered a massive journey today, and it all really comes back to how your body carries the weight of the decisions you make.
Absolutely.
We started with the counterintuitive fact that even after a total hysterectomy, patients still need decades of vaginal exams to screen for lurking cancers.
Yep.
We learn the mechanics of how tightening procedures rely on either surgically cutting tissue or causing controlled thermal injury with high-powered lasers.
The shrink wrapping.
Right, the shrink wrapping. We saw the very thin line where that healing process crosses into vaginal stenosis, creating rigid, inelastic scar tissue. And finally, we saw how that stenosis acts as a literal barricade, making those future vital cancer screenings either incredibly painful or completely impossible.
It truly emphasizes the deep, unforgiving interconnectedness of our anatomy over time.
It really does. And so, to you, the listener, as you think about the sources we've unpacked today, I wanted to leave you with one final thought to mull over.
Okay.
We've talked extensively about the physical consequences, but consider what this means for the concept of informed consent. A cosmetic doctor or med spa technician performing a laser treatment on you today is almost certainly not the same doctor who'll be trying to navigate a speculum to find precancerous cells in your body 20 years from now.
That's a great point.
When the catastrophic complications of a procedure outlive the typical doctor-patient relationship by decades, how can true informed consent even exist? Are we allowing the fast-paced anti-aging industry to rapidly outpace our long-term preventative care?
It is a profound systemic question. And honestly, it's one every patient should weigh before allowing any unregulated intervention into their body.
Well said. We hope this deep dive gave you some serious clarity in what is definitely a murky, highly marketed landscape. Keep asking the hard questions. Always demand to understand the long-term mechanics of your own body, and we will catch you on the next one.